So we've talked a little bit about the potential risks for miscarriage, the pregnancy ending in the first trimester, and we know those rates are on the higher side. But it's also possible that after you've made it out of that first trimester, that something could happen to the baby during the rest of your gestation. It's not as likely, but it can happen that your baby's heart may stop beating sometime prior to full term or at the end of the pregnancy. And so let's talk about what some of those potential risks may be.
So when we fly somewhere, we get told all about the risks of flying, even though we know it's highly unlikely that that is going to happen. And so, as your healthcare provider, it's important for me to tell you about the risks of what may happen in pregnancy. So one of those risks that I need to let you know about is stillbirth. And there are risk factors involved that I'm going to talk you through that you need to be aware of. But much like flying, as I said, it's highly unlikely that it'll happen.
And one more thing, while I know this probably won't happen to you, I want you to know about something called stillbirth. That means that a baby's heartbeat stops sometime during the pregnancy. When we ask you to do kick counting, one of the reasons we're asking you to do that is to try to keep a sense of how your baby's personality is going and how your baby's health is. And if your baby starts to slow down or something unusual happens, why don't you come on in, because we want to try to prevent such things as stillbirth. Before actually giving the news, the specific news that the baby's heart has stopped, that the baby has died, it might be really a wise idea to give a transition. To say something like, oh, I'm a bit concerned here. There's something I'm not liking. And let people kind of get ready for the news before you say then something like, this is really upsetting and I am so sad to tell you, but it looks like your baby's heart has stopped. It looks like your baby has died. Take a breath with me, because this is really an awful moment, and I wish I weren't sitting here having to tell you this. But I just want you to know that whatever happens from here forward, my team and I will take care of you. We have really good people who are going to take care of you. So let's just take a little pause and a break right now.
Okay, so I want to talk about how your baby's doing. We've taken a look at the scans, and I'm so sorry that your baby's heart has stopped beating. I can't find it on the ultrasound because it isn't there anymore. Your baby has died. I'm so sorry this happened. We're going to be here together. I know you have lots of questions.
So when giving the news, it's really important. The classic things we all hear and know, but we really need to be mindful of this at this time, is to get down to the level where the parents are. If you're in an office, sit down at the same level as them. If you're in a bed, sit down, but don't be standing up high telling the news down. Don't be holding a clipboard in front of you. And of course that's a natural thing to do, because it's fearful, it's a hard thing for us to deliver that news, and we're trying to protect ourselves. But try and be open and have that open body language, and speak gently and softly, and before you actually deliver the news, take a breath yourself and maybe ground yourself and think about how compassionate you want to be, and how you are a witness to disrupted dreams. You are the person delivering perhaps the most important or the saddest news that this couple, this mother, will ever hear.
So do you see where your baby is? This is where your baby's heart is. But your baby's heart isn't beating, and there isn't anything that we can do to get the baby's heart to start beating again. I'm really sorry. Your baby died. I'm just going to share what my doctor said when she delivered my baby Avery. It isn't often we get to give birth to angels here. And then she stepped out of the room because she had to cry, and she didn't want to cry in front of me. But those tears are so important, so don't be afraid to cry if that's how you feel.
One of the things that you can say are, and hopefully it comes straight from your heart, your baby is so beautiful. Mom, you did a really good job. Dad, you were a great companion during this birth. Others have told us that the staff said, oh, happy birthday, baby. This is their baby who was loved, and this is their baby's birthday.
So these are some of the things that parents have told me that have been really meaningful to them. One is that you are a mother to this baby. You don't let anyone say you're not a mother. You are little Bobby's, little Sally's mother, and always will be. I'm so honoured to be here at your baby's birth. It's a life-changing moment for you, and it is for me as well. The things that parents say touch them are kind and compassionate words that come from the heart.